Thank you, sir, for those insight and setting the stage for the webinar. I would like to invite UNICEF team and also NICE team. From UNICEF India, we have with us Dr. Mainak Chatterjee. He is health specialist immunization, and he is working with program on the energy aspects very closely. With him, we have Ms. Chehek Ahuja. She has been working with NPCCHH for almost a year now. She's been closely working on helping us developing technical guidelines and also support in implementation. She is a consultant from UNICEF. I would like to welcome both team members from UNICEF on board. So many of the states and my district also know that UNICEF team have visited the states and understood the different aspects of energy requirement in the health facility. So they will be taking care of some of the states and helping them in these aspects. Apart from that, we also have PHFI team. Their team will also be working with some other states. Apart from, so I think let's go with the UNICEF team now on aspects of energy efficient measures in health facilities. Over to Jack.
Before Jack comes in, very good afternoon to the team at NCDC. Akash sir, Puri madam, thank you so much for this opportunity. Welcome, dear colleagues from the state and district levels. This is a very big honor for us to address all of you and try to present our thoughts. Thank you to the NCDC for providing this opportunity. And for this presentation, Ms. Chehek will lead you through the energy efficient component, while Dr. Nikhil, who is the Assistant Director Technical from the National Institute of Solar Energy, he will be talking about solarization of health facilities, followed by briefly question answer, if any, from you, and then we will wind up this particular session. So Ms. Chehek, if you can kindly move to the presentation, please. Thank you so much.
Thank you, Mainak, and thank you everyone for joining today afternoon on this special occasion of World Environment Day. Also, many thanks to Sir HOD Sir for presenting the context of the presentation and the discussion here today very nicely, and informing everyone about the program activities and how energy efficiency and health is interlinked. We would, through this, I would just like to try to present to you how the emissions and energy and the work that we are doing under the program is interlinked, and how we can better move forward with achieving the objectives of the program. So with your permission, I would like to start. I hope my slides are visible.
Yes.
Okay. So the first part, understanding the interlinkages of environment and health. As most of us understand how climate change has been called the biggest threat, etc., for the health fraternity, and how it has been impacting human life.
Excuse me for interruption. The slides are not visible.
It's visible.
They are, yes, they are visible at my end. So if they, yes, maybe in network problems.
To us, I believe.
Oh, thank you. So as I was saying, how climate change. So I would just continue. So as I was saying, that how climate change and external weather phenomenon that is there as a part of our environment and as a part of our this thing has been impacting human life. This has been happening in multiple ways, where we are talking about temperature variations, we are talking about rainfall variations and humidity variations. Based on the external weather phenomenon, this is manifesting these external weather phenomena are manifesting themselves in different ways and forms and affecting human health. So if you could be able to see the small figure that is presented here. So we're talking about the environmental hazards, that is extreme weather, rising temperatures and sea level rise, and how they are transforming to climate change consequences, resulting in flooding, poor air quality, extreme heat, drought, wildfires, and change in infectious agents. This in turn has increased the burden on the public health structure because of increased burden of diseases and deaths, occupation safety, infrastructural damage, and the need for to be able to continue with the services. So we state presenting that how the external phenomenon is impacting the human health collectively as well as at the individual level. The program has looked at to address these issues by looking at climate change mitigation and adaptation measures. Under the mitigation measures, we are talking about adopting of green environment friendly climate services. So this becomes a part of the buildings and in the infrastructure of the program, which is called the green climate resilient infrastructure. Why do we need to do this? Because of the greenhouse gas emissions. As Sir already mentioned, currently health forms around 5.5% of global greenhouse gas emissions. Why is it important to address this? Because as the need and as the infrastructure increases, the level of emissions also increases, which in turn increases the burden on human health, thereby making it a priority to address these issues currently so as to reduce the burden of emissions and hence the burden and the impact of climate change on human health. Secondly, as this graph is demonstrating, what we have found out that the major chunk of emissions in health sector comes from the electricity consumption and electricity usage, which is why we are talking about energy efficiency today and trying to address and looking at measures to address energy efficiency. Moving forward, the energy efficiency becomes a part of scope 2 emissions under the greenhouse gas contribution. These scope 2 emissions talk about the indirect emissions, refer to energy and usage of electricity, steam, cooling, and heating in our facilities. The first scope 1 emissions account for the direct emission sources, which account for on-site fuel consumption in healthcare facilities and vehicular consumption. And then scope 3 refers to the supply chain related emissions. We are targeting to begin with scope 2 emissions, that is energy efficiency and electricity related emissions, as they contribute the largest share to greenhouse gas emissions. I'm not sure if the slide is moving forward. Can somebody please confirm?
We can see your slide on GHG.
We can see. Yes. Is it on GHG emissions, healthcare sector and GHG emission?
No, I have moved further.
No, that is not visible as of now.
Yeah. Now
yes.
we are
Yes. Now we are.
Yeah. So again, just reiterating, as it was mentioned, that we need to work on this part of the program, because the current estimated footprints are at around 5% of emissions from the health sector. And as we all know, there is an additional burden, there is population rise happening, there would be an additional burden on the healthcare facilities, there would be an increased need of electricity, and this increased need of electricity would add an increased burden on the emissions if we continue to use in the current format of using fossil fuel based electricity generation, as well as continue with um, the technology that we use in electricity and the regular consumption pattern, which is why these are the three areas that need to be addressed. Also, there is an increased burden of illnesses due to climate change impacts, and increased frequency of extreme weather events also is contributing to extreme number of illnesses and morbidity, as well as social and economic losses. Another very important criteria for the health sector to address this issue is because of the principle of do no harm. When we are, as part of health sector, using this kind of energy, we are contributing to the environment and harming the environment in some manner, which is why to kind of reduce this impact of the environment, it is important for us to work on our energy needs and energy efficiency needs. Also, in context of India, I need not mention, there are still a lot of places where continuous supply of electricity is an issue, which in turn leads to a lot of disruption in provision of healthcare services. When we're talking about energy efficiency, we are also proposing use of solar panels. This would kind of support in development of decentralized renewable form of energy, which would also support for the healthcare fraternity to meet all its needs and continuity of services and provision of well-being. Then when we're talking about this issue, it is of course at the national level that it needs to be addressed, that is energy emissions and reduction in greenhouse gas. And also at the personal level, when we're talking about this program, we are also talking about communities and personal consumption reduction, which is why whatever activities that are being proposed under the program kind of try to address these things. As you must be aware, under the program, green and climate resilient guidelines were launched in February. It is available in the website as well. Under the part of these guidelines, we have identified 4 areas which are critical to look at when we're talking about climate resiliency. One of these areas is energy, that is introducing sustainable energy practices. This primarily includes low lightning fixtures, that is what we call it LED replacement, introduction of switch off policy, introduction of renewable energy sources, that is solar panels, energy conservation, and contributing to overall energy efficiency measures. So currently under the program, the technical guidelines on green and climate resilient healthcare facilities have been prepared and provided. There are also guidelines on solar power of healthcare facilities, along with the PIP guidance note also mentions these activities. There is also, as webinar being one of the platforms, we are also trying to build up capacity building and IC related to this issue. Now, talking about energy efficiency, what are the proposed activities? Under the program, the key proposed activities include replacement of existing lighting fixtures to LED. This is completely aligned with Kayakalp eco-friendly facilities as well. Second is optimal utilization of natural lighting, also very much linked to Kayakalp eco-friendly facilities guidelines. Using of energy efficient equipment. This includes minimum 3 to 5 star BEE standardized usage of medical equipment. Then we have proposed solarization of healthcare facilities, under which couple of activities have been proposed and lot of support and initiation has been done with the state. It includes identification of healthcare facilities, conduct of energy assessment, issuing of tender, conducting monitoring mechanism installation, as well as ensuring continuity of services. The third proposed activity is energy audits. Again, I think I am stuck. I am on energy efficiency slide and it's not moving forward.
Yes, we are at the ongoing activities slide. Can you please reshare? Should come.
Yeah, I'm trying to
some
do
network
that.
issue at your end probably.
Yeah, I'm trying to reshare on. I think it's visible now.
No, the slides are
not
not
currently.
visible.
Yes, now it has come. Yes.
Yeah. Okay. Thank you. Right. So we were talking about energy efficiency. What are the main energy efficiency measures that have been proposed? And also, how would it help the healthcare facility? So these are the two things that we will be talking about. One, what are the energy efficiency strategies and how would they contribute? They would support in cutting down the operational costs of the facility. When we're talking about LED replacement and or solarization and or usage of medical equipment with better standards, etc., the operational cost at the initial beginning, that is the installation cost, would be there. But over the years, it has been proven in short term as well as long term that the operational costs would be reduced. Second, it would also help in reduction of greenhouse gas emissions. And third, overall, it would help us in the major objective of protecting public health from climate change impact. So these kind of strategies have been proposed under the program so as to look at preventive measures along with the responsive measures that the healthcare has been a part of. So currently there is 65% of energy consumption in healthcare facility that occurs by lighting, water, heating, cooling, and ventilation facilities. As per IPHS, at least 3 kilowatt per bed per day is the current energy consumption scenario. And from the total energy, heating forms a major part, that is 34% of total energy use, and lighting is the second major contributor, which forms 21% of the total energy consumption. So, which is why all of the activities that have been proposed under the program on energy efficiency try to look at these major contributors. So, as a part of strategy, what are the key things that are proposed? First is that healthcare facilities are to have a key process for energy savings. This process might include having a proper policy, having a protocol system in place, and or identifying people to conduct these activities and follow. Right. So second is the policy of using and purchasing energy efficient equipment and devices. Third is to develop a plan for the use of alternative sources of energy. Then we come to energy audit process and training of staff for energy saving techniques. These are the key areas that have been proposed for the healthcare facilities to act and support in energy efficiency measures. Under this, what are the key activities proposed? This includes 1. Replacement of existing lighting fixtures to LED. It has been seen from various studies that LEDs consume 75% lesser energy than the regular lightning incandescent bulbs that are used and also have a longer lifespan. Secondly, they consume less than a third of the total energy consumed by these fluorescent lights. And also they save around some substantial amount of money over the longer period of time. Second, what has been proposed under Kayakalp as well is inclusion of optimal utilization of natural lighting, making it as a part of a protocol and usage that whenever there's natural light, it has to be utilized and we need not keep on our regular electricity bulbs, etc. on at that time. Then introduction of a switch off policy. This has also been made a part of the activity list that has been proposed under the WED celebration for 2023. Switch off policy, what does it mean? That for every switch, etc., they need to be labeled. Then special people need to be appointed, like to monitor and to make sure that whenever these are not in use, they need to be turned off. And unnecessarily, we do not keep our plugs, etc., on if they're not being in use. The fourth part of it, which is very important, is to keep these light fixtures, etc., clean and follow their regular maintenance, as well as replacement of these flickering lamps with the new LED lights, and also to report these maintenance issues. What is presented here is, under the guidelines, the kind of LED requirement that is there for a typical facility, starting from CHC, a PHC, a state, STH, as well as a district hospital. What are the LED requirements for different kind of areas has been mentioned. Would request all of you to refer to it whenever needed. So it identifies what are the high risk areas and what is the illumination required for that, and accordingly what should be the LED requirement for that room, the moderate risk areas and the LED requirement, as well as the low risk areas and the LED requirement. These calculations have been based on the IPHS guidelines and the suggested room, the spaces and the area, and the illumination requirements. The next part of it is use of energy saving equipment. It has been proposed to use above 3-star rating electrical equipment, including computers, monitors, printers, scanners, everything that is part of the administrative equipment as well as the medical equipment. These equipment consume 30 to 75% less energy than the standard equipments that are present. And also a policy to be developed by the healthcare facility to purchase B-labeled ISI marked equipment and alliances. These might come across as multiple things when it comes to looking at cost and infrastructure maintenance, but these efforts need to be taken in a phased level. Under the PIP, there has been budgetary provisions under the program to undertake these efforts as well. Why is it suggested these efforts should be taken? Because when we're looking at LED lighting and when we're looking at energy saving equipment, as well as when we talk about solarization later in the presentation, all of this would contribute to cutting down of the operational costs, reduction in environmental hazards, increase in facility productivity, increase in well-being, and also in support in overall contribution of healthcare sector to addressing climate change and climate change impact on human health. These are just a couple of pictures of the efforts being done for solarization of facilities. I would like to stop here, and if there are any questions, I'm very happy to take them.
Maybe a request would be to complete the presentation on the solarization, and because they are related topics, we can have questions at one go, if that is acceptable. Purvi madam?
Yes, sir. Let's go for the second presentation, and we have question answer at last. Yes. I would like thank you, Chahak, for that information on energy efficiency and how it is important. Let's go to our next presenter. He is Dr. Nikhil, Assistant Director Technical from National Institute of Solar Energy. And he has been working with the UNICEF team to develop different tools and technical guidelines on solarization of health facilities. So I would invite Dr. Nikhil to come on and talk about the topic.
Hello. Good afternoon, everyone. I hope I'm audible.
Yes, sir.
Audible, sir.
Yeah, thank you. Thank you. So very good afternoon. I am very excited to see 150 plus participants on this very auspicious day, because everybody is celebrating World Environment Day. In fact, we also had a long day celebrating this in our campus. Thanks to the NCDC for hosting this event, and also all the participants for joining, and of course many thanks to UNICEF for inviting me to be a part of this webinar and to present our thoughts on this. In fact, Madam, in her presentation, Chahak has mentioned most of the important aspects of the energy efficiency or related energy efficiency aspects. One of the methodology which even Sir was also mentioning is inaugural speech was like solarization. Solarization, how it could be a part of a energy efficiency activity, how we can contribute to the reduction in the carbon emissions, what we are talking about, and how the health facility or healthcare facility as a whole can contribute, how healthcare facilities can contribute in totality in the energy efficiency activities. I hope my presentation is visible, sir.
Sir, we can see the first slide.
Okay,
yes, visible, sir.
So just before I go further, let me put one single slide on what we at NISC do. We are National Institute of Solar Energy. We comes directly under the Ministry of New and Renewable Energy.
Dr. Nikhil, can you speak little loudly? Sorry to interrupt.
Yeah. So we directly comes under the National Institute of Solar Energy. A Ministry of New and Renewable Energy. And major core activities of NISC are into the technology aspects specific to the testing, standardization. We are also a part of research development in the recent technologies. The product development, couple of our products are also commercialized. Even one of the product is also commercialized in the health facility sector. I will show you that in my last slide. Also, we are into consultancies, providing field testing and performance evaluation in solar projects. We also provide trainings related to solar to many categories of participants from the government staff, the PSUs, the students, entrepreneurs, the foreign delegates, all sectors. So we are basically a solar energy institute which focus mostly on the technology front. We are situated in Gwalpahadi, very close to the Delhi border. So in this particular 20 minutes, as discussed, I'll be a little bit focusing specifically on the technology options related to solar for healthcare facilities, because I'm sure other energy efficiency aspects have already been discussed. So we will go a little bit in depth on the solarization aspect, and also a couple of technical and practical aspects of implementation, because I understand most of the nodal agencies or officials are in the process of or already started the process of implementing the solarization in their respective states. So we will give some overview from our own experience and our own thoughts. In India, I think we are very much fastly progressing with respect to renewables. If you look at our already existing achievements in the renewable sector, we are at almost 125 gigawatt of renewable energy as on April 2023. So that contributes to almost 30% of the installed power. So to put it in a very simpler way, out of every 4 units of power you consume, one unit of power, actually even more than 1 unit, comes from renewable sources. And we are focusing on to further enhance this to in the scale of say 350 to 400 gigawatt by 2030. Specific to solar, we are at 67 gigawatt, and in solar itself there are many categories. Probably you might have seen. आप लोगों ने बहुत देखा होगा, like कुछ plants rooftop में भी हैं, कुछ ground में भी हैं, and there are certain off-grid combined power plants which are like battery-based systems. So mostly the bigger chunk of power plants related to solar is in the ground mount. Very few, comparatively very few, are on the rooftop, and further a very little amount is on the off-grid or combined mode. So when a health facility is solarized, so automatically the off-grid combined or component will add up, or the solar rooftop component, either of them will add up to the numbers. The fundamental difference I should put up here is that in a typical rooftop plant, it is basically a prosumer category system. That means whatever the whoever is the consumer of the electricity, I think Madam has mentioning that one of the can be done when in the electricity consumption sector. So wherever the consumer is consuming electricity, he or she is able to produce that particular electricity at the same premises. We call it as a prosumer. So most of the rooftop sector actually belongs to prosumer category. That means whatever the requirements of solar is required, it is produced on the same premises of the location. In the case of a ground mount, they are like larger power plants which are like spread across hectares, where the energy is generated and it is sold off. It is just like a business category sector. And off-grid are typically those systems which requires backup, or see the typical solar pumping applications. All those comes under the off-grid sector. In technology options, as I mentioned, there are 2 basic technologies which are available specific to healthcare facilities. Also, I can able to relate that. One is normally what we call it is a off-grid or a standalone based technologies, in which the solar module which generates current and it can store the energy in a battery and also feed the load. It could be an equipment, electrical equipment in the facility. And whenever there is no sun available, whatever the stored energy can be utilized by the load. There is no specific grid connection available, or even if there is a grid connection available, it is not a problem. That from the grid energy, current can be taken and charge the battery. So we can always import the energy from the grid. We call that a technical word, importing the energy or taking the electricity from the grid, and we can charge the battery. So always the battery can be at a full charge. These type of technology application.
Can you be a bit slow and loud so that we can understand? Thank you.
Okay. So these type of technology options, the features are typically for small or medium capacity. As I mentioned, the healthcare facility would be an ideal option. I think there is a disturbance. I request all of you to keep the mic in mute. All others, please. Okay, so this kind of is the technology mostly which is preferred, especially in the rural side of healthcare facilities, where the power cuts are very prominent. As I mentioned, even if there is no grid available or grid is there, it can still work because we generate energy, current, power, and we store it in a battery. We can use that for the load whenever we require the load. These are very good, which can provide energy backup, as I told, and very suited for DC loads. In fact, many of the facilities, healthcare facilities we visited, we could see the solar-based drives driving the vaccine storage. A small system. It is a very typical standalone systems. So for a DC load, it is a very suitable one, and it is very suitable for remote and portable applications, as I mentioned. The second option in the technology is the on-grid or a grid interactive systems, in which the fundamental difference you can see from the picture is that there is no battery. That means you are not storing the energy in a battery. But instead, what we do is that whatever is in excess energy generated, we can bank it in the grid itself. So there is always a storing of energy on the grid. Whenever we want, we can take it back. So it is just like import and export. During the night, we can take back from the grid. It will be accounted, or it will be adjusted in the respective meters. We call as a net meter, which is installed during the process of solarization process. So this type of system is good in the perspective that there is no battery storage, so the cost is comparatively less, and of course the payback will be much better. There is no problem of so whenever the ultimate objective of the user is to save the electricity bills, or make tremendous changes in the electricity bills, of course grid interactive is a much better option. But one of the challenge of these facilities or this system is that for this system to operate, there should be a grid reference. So grid should be always available. So when there is a power cut, imagine your health facility is in a location where there is a frequent power cut happening, maybe for 2-3 hours, especially during the daytime. So during the state of power cut, the entire system is disconnected or is off, because this system is designed to operate in that way. That is to ensure the safety of the people, okay, who are working on the grid. So as I mentioned, this particular system always requires a grid interaction. Hence, these are very much suitable for those locations, the healthcare facilities, where the grid grid lines are more stable and can provide a very continuous power supplies. The best part is that we can bank the energy on the grid and we can take it back. Generally, there is no battery bank exist in this kind of facilities. Typically, whatever or facilities we have visited or we have studied, since healthcare facility is a very essential service sector, and since there are locations which are having prominent power cuts at least for 1 or 2 hours, and there are critical loads in the facilities, off-grid systems are typically much more favorable in the healthcare facilities. Why solarization? It provides access to a reliable electricity. That word is very, very important, because that will ensure access to electricity is one important thing, and access to reliable electricity is a very, very critical aspect, because you might have electricity connection, but and you might be getting electricity bill also, but if the intermittency is very long, then actually to operate it and to run the facility to meet the requirements of the patients, it will be very difficult. One of the best part of solar technology, I always say, is it's a decentralized technology. So you take from Kashmir to Kanyakumari, or even Ahmedabad to far northeast, everywhere you have sunlight. So the technology can operate anywhere and everywhere with as long as you get sunlight, it can generate electricity and it can store it. So that's a decentralized technology. That is the beauty of it. It can provide options for backup in those locations where even the access to electricity is not those hilly terrains where it is difficult to find other sources of fuel. This decentralized solar can provide a backup options, and it is a very good in that perspective also. It also contributes to energy efficiency. So now this has a very little more a bit technical perspective. So imagine that I am at a location, say X, somewhere in Gujarat, and I am consuming the electricity which is generated, say 1,000 kilometers away from that particular location X. So for that generation point to the consumption point, you can see when the electricity transmits through the transmission lines, there is a lot of losses happening, and eventually we are paying for that loss, the user. So in the case of a solar, as I mentioned, we are generating the energy at the point of consumption. So that means we are also having energy efficient process in the process of generating electricity from solar. Of course, it can reduce the CO2 emissions approximately. To put some numbers, thumb rule numbers, like 0.8 kilogram for every unit you generate, you can mark it as savings. And the best part is the modular options. So whenever I feel I want to expand my size or inverter or storage, you can just plug and play connect, and you can do some design tweaks and you can scale it up. That is the best part of a solar based technology system. The impact it can bring in the solarization in the healthcare facility, of course, is the improved quality and quantity of the healthcare facilities, because as I mentioned, that the access to a reliable electricity can always bring the quality in the existing services, but also can add more critical and relevant services which are required for certain local communities. I think this is a very good solution in that perspective. Financial savings, of course, because you are saving on the electricity aspects. Also, there are facilities where they run diesel generators, so the diesel savings will be another cost impact which can be contributed. Uh, uh, I think I was also very amazed to see that most of the facilities we visited across the nation, they had a vaccine storage, and it is very happy to see that, because it has reached to even the last mile. But sometimes you can see that to operate this vaccine storage, you need a reliable supply. So solar can obviously provide a reliable supply of electricity and reduce the wastage of vaccines, and ensure that the right temperature is provided to the sensitive commodities. It can reduce the health appliance damages because of the voltage fluctuations. In many locations, you can see many equipments or the instruments gets damaged. Also, it can improve the productivity and well-being of the staff. We have literally even witnessed that sometimes because of the lack of the reliable electricity, many people may feel it difficult to be come there or reach or to get access to that particular location. And once this solarization happens, when there is a facility provided, I think it will also motivate the existing staff to improve the productivity. It has also the increased access to the health facilities as a whole, and the last mile healthcare facility access can be ensured, because as I told, it's a decentralized technology. Even at the last point, if you want to improve or add a new health related service to a patient or a community, the solar could be one of the best option to adopt it there. Even for a temporary setup, you want to have some vaccination campaign or a blood donation campaign, such solar portable systems are also available, where a last mile facility can also be provided to the required patients. Coming to the solar PV power plant installations, it is typically not a very big or a very rocket science. It needs a specific data collection in the initial stage, to the site analysis properly. Based on the site analysis, we understand whether the site is suitable or not, and then looking at the suitability, we prepare a design report, how much should be the capacity provided. Then normally in a government system, it goes with a tender, then the execution and operation maintenance. So this is a typical process or steps in the solarization methodology. And once a system is installed, you can see typically solar modules has a life up to say 20-25 years. But batteries, of course, is something which need to be replaced after a very certain life cycle, say number of cycles. It can extend up to 5 years, sometimes 6 years, sometimes 4 years also. So that depends on how better you use the batteries. Now coming to the site visit, typically the data which is collected during the site visit are related to the health facility. We look at what kind of health facility are they, whether it is PHCs, CHCs, or even the health and wellness center, because that tells us how big or small the facilities are. Then we look at the electrical parameters in the facility. What are the connected loads? What are the typical critical loads available in the facility, and what is the kind or type of the load, which is like a resistive load or inductive loads. All these parameters can be assessed. We also look at the space and the building parameters, because we need to put or install the solar. So we look at where we can install the solar, whether you have enough roof area or ground area, whether the building is in the right direction, are the shadows available in the site, and the geographical parameters, of course, because sunlight and temperature parameters are important for the operation. So we also look at the geographical parameters and electricity bill. Most of the inputs we get from the electricity bill in the case of a healthcare facility, because that will tell us almost like what is the profile of the electricity utilization or consumption in that particular facility, and how far or how long it is operating. Also, it gives a very good understanding about the HCF operations. Coming to the couple of pictures, electrical equipments, you can see we look at the data specifications. We look at how efficiently it is operating. We look at the star rating, space availability, and the building details. We look at whether we have enough area. We also look at the roof types, because essentially we need to put up the solar on the facility, whether the roof will be able to withstand that much load or that much weight, and it should be operational for another say 20 years, whether it will be able to withstand so long. Are there possibilities that it can be shifted from that location? So there are various aspects which will be taken care during the site visit. And the most important, even the practical scenario which we have noticed, is that there are certain or many facilities in which the existing distribution lines are a little bit in its very older format. So there are requirements where we need to see a retrofitting or keep aside a separate distribution lines for the solarization aspects as a whole. So these are a couple of technical things we look during the data collection. Once the data is collected, then we go for the design aspects. As a typical design report, as I told, we always look for a off-grid or battery-based system, because eventually we are looking at a system which can support the critical loads during the load shed hours or power cut hours. So backup hours is very important. That depends on the location to location. Those locations with higher power cuts, you can go for higher backup hours. Frequent intermittent power outages, you can go for higher backup hours. In one of our recent visit to certain states, they intimated that there is not at all a power failure in those states. So there are certain scenarios where even the on-grid system can also be proposed. That depends on the requirements and as per the HCF electricity pattern and the requirements. The type of the loads, we look at the critical loads and the non-critical loads. Yield assessments of the location. Basically, in India, the solar availability is not similar in every location. It varies from location to location. So we can see in certain location it can generate more energy, more current. So we will look at how much in a year it can generate and contribute to the energy savings. We also try to normalize it. The normalization is a very fundamental rule, because if you take a district or even two district adjacent district, the energy consumption pattern in all these all the healthcare facilities of these adjoining districts may not be similar. There could be little bit variations from each even from the PHC to PHC, PHC1 to PHC2 to PHC3, or from CHC1 to CHC2 to CHC. So there should be some kind of a rationalization we need to bring in to normalize the design part. And of course, cost is one important aspect, because eventually we require enough funding pattern or support to you put up this project on the ground. Retrofitting, we look at the options for retrofitting, because there are already existing connected loads, or even there are certain facilities already existing. Solar is the, so we also look at retrofitting, how we can retrofit the new proposed solar with the existing, or change the entire existing distribution line with the new distribution lines. So just to put it in a nutshell, the sunlight is not similar everywhere. So that is one criteria the design will depend on. Second, the backup hours is basically influencing the energy storage or the battery bank. So when any particular healthcare facility, the location is having very short duration of power cuts, you can prefer a small backup hours. That means your battery bank capacity will reduce, cost will reduce substantially. But when you need a much more backup hours, essentially it will influence the battery bank capacity and of course the cost. If you want to connect more loads, say for example, I want to connect instead of 20 tube lights, LED tube lights, I want to connect 40 tube lights, LED tube lights. So the ultimate influence will be on the capacity of the inverter. Or if I have say 2 vaccine refrigerator instead of 1 vaccine refrigerator. So the number of additional loads is typically influencing the size of the inverter. These are the couple of indicative list of a critical loads, as this we have taken from the Ayush app. Like these are, because if you really want to provide backup to the entire facility, it might be a very costly affair. One thing. Second thing is that you need enough space for that. So typically what we look at is that we try to identify those critical loads which are very much essential, and it should be operating whatever be the happening to the existing electricity scenario. So these are a couple of indicative list, but in certain facilities they always add, say, okay, I need to add this also as a critical load, so we can consider that as well. Some indicative numbers, it is not I will not say very conversion at this stage, but from our couple of experience, we had visited almost like 30 plus healthcare facilities across India till now. So we can see that most of the critical load patterns or the critical of a CHC, it is up to, I'm talking about the critical loads, the electrical equipments, and the tentative range of solar PV module which could be put up is somewhere near to 8 to 10, and in a CHC, it is in the range of 16 to 20. Again, depends upon the available area as well as the sunshine hours. So from state to state, it may vary. From facility to facility, also it may vary. And the battery backup, as I mentioned, it is a purely dependent on the power cut scenario in that particular location, especially the intermittencies in that location. So typically those CHCs are located little bit more on the city or town side, where they may have a dedicated power line also, hotline. So but still, again, as I mentioned, specifically certain cases it may vary. The approximate area requirement for a 8 to 10 kilowatt solar is the shadow free area would be somewhere near 200 square meter, and in the case of a 20 kilowatt it would be somewhere near to 200 square meters. So this is some numbers just to put it in your page. Just last one discussion slide on certain practical challenges, because this is very important once you start this activity on solarization. The accuracy of the data is very, very important, because many times we visit the data, we try to get as much as data uh, by two methods. One is observing the data, what we see across the campus or the facility. Second is by interacting with the health official staff. So the accuracy of the data should be very important, because that will eventually decide what is the system capacity. So in case of say 3 to 4 hours backup, if we say there is a lot of power cuts, so then we may have to go for a 10 or 11 hour backup. So the data accuracy is very important from the perspective that it will eventually influence the system design as well as the cost. Many of the facilities which we have seen or visited was like, it needs a couple of retrofitting options are very, very important. So retrofitting could be one of the practical challenge in many facilities. User awareness, of course, as energy efficiency is the topic for today. Many by themselves feel that, okay, I will switch everything to my every of my load to solar. Say I'm using a pump, water pump, I may using a computer or a fan. So especially the off-grid systems, I'm not talking about the grid interactive or on-grid systems. Off-grid systems are designed to cater certain limited loads, as I mentioned, critical loads typically. So it is always important to give more awareness to the user that these are the loads in which solar is connected. These are the essential loads in which solar is connected, and this need to be a very important aspect. And energy efficiency awareness is also, I feel that to be brought in a more awareness in many of the facilities, more labels, energy labels. I think she was mentioning about energy labels, energy indicators, 3-star, 5-star rating should be displayed in the facilities. The data challenge which many times happen is the geographical diversity. So the data which we may see for a PHC in the state of, say, the southern states may not be the case when we go to the northeast state, or it may not be the similar when we go to the western part of the country. So there is always a diversity in the data we collect. So we cannot generalize the things as a whole, but still, as I mentioned, we need to look at the real statistics, what is happening, what is the actual scenario in the facility, what is the electricity bills telling about the usage patterns. From that, we need to come up with a very good solution for the solarization. Finally, maintenance is a very inevitable part of any project, not just solar. 5-year comprehensive maintenance is very, very important in all the solarization projects. Maximum, it is advised that we can use localized resources. So there might be localized technical manpower who can come and help and support if at any point if there is any sudden requirements are there, because that will reduce the attending time, that thereby increasing the performance or increasing the performance indices of the systems. So I think I will also show you one of the applications. This is a cold storage, solar cold storage, which was developed at NICE, and it is now installed at Government Medical College at Calicut. They use it for vaccine storage. This is completely running on solar. These solar modules are on the top of the terrace. And you can see there is no battery backup. We have thermal storage system which can maintain a temperature of say 4 to 8 degrees. Typically, these systems have multiple applications, not just to vaccine, but for other cold storage applications as well. Any remote locations with a certain capacity requirements can always use these kind of systems, which can contribute in a very efficient way to the energy efficiency or energy climate change activities of the facility. So with this, I'm concluding here. I think within the given time, I have given a quick overview of solarization aspects, a little bit from the practical aspects also. Thank you again, NCDC and UNICEF, for this chance. Wish you all a good day. Thank you.
Thank you, Dr. Nikhil, for that elaborate presentation on solarization. So I'm sure other people will have questions. They can type it or raise their hand. I have some questions that I would like, and I'll just like to summarize for all our officers that what actually different kind of solarization mean. So I understand that you and UNICEF have started going to different states and also understanding how it works in health facility and started developing a tool, right? So that will help them assess health facility in terms of what are their critical loads, then what is the facility type, and then space of the building, what kind of roof is there, what kind of solar energy they are receiving, and from the electricity bill. So that is the tool I think you are developing. Is that right?
Yes, ma'am. I think we are developing a mobile app tool. It is almost in the point of completion. We are just doing the testing aspects of it. So it is basically a checklist in the form of a mobile app, which is a very exhaustive checklist. As you rightly indicated, we will be collecting as much as data related to the electrical parameters, some of the health related data, some of the energy efficiency related data, in fact, some of the benchmarking requirements of the energy efficiency as per the Bureau of Energy Efficiency guidelines, and the space requirements or space availability in the healthcare facilities. All these will be mapped using this checklist, and this will help us, doing analysis for proposing the system design and the capacity for the facility.
Okay. The other thing also I want to summarize for the officer is about the solarization. So just say we all are doctors and we have not studied this aspect in our education. This is something new for us, but as officers and as in charge of health facilities, I think we should understand what are the different types of solarization. तो if I talk personally, जब भी मैं solar panel देखती हूँ तो मुझे लगता है कि वो सिर्फ energy generate करता है, but now I understand the solar panel का different use होता है. I think, correct me. So sometimes solar panels are used only for heating purposes, where the water heating is used, right, in the health facility. Sometimes solar panels generate electricity, that is photovoltaic use of solar panels, and in which you describe that they might be connected to grid, where where the energy goes to grid and comes back whenever you need, and there is no battery in between. And sometimes there is no. Sometimes it is standalone, it is not connected to the grid at all, and all the requirements are fulfilled by the solar power, the panel and storage in the battery. And then sometimes there are solar water pumps also. Is this something right?
Yes, ma'am. Whatever the sunlight, when it is converted to electricity, it is using solar modules, sunlight. But if you're converting the heat energy of the sun, that means the thermal energy of the sun, to the thermal applications, as you mentioned, for heating application, they are called solar collectors, solar water heaters or solar collectors. It can be used for heating, any kind of heating applications, let it be water heating. There are applications for cooking also. In many places they use for cooking of the food. So and some industrial uses are also there. But when you convert light to electricity, it is solar modules.
Okay. And one last question. So you showed the map of India that some part of the country are more exposed to sunlight and some are less. I just have out of curiosity मुझे जानना था कि सोलर के अलावा क्या कोई अदर रिन्यूएबल एनर्जी है जो अदर स्टेट्स में ज्यादा यूजफुल है कंपेयर टू सोलर, या ऑल द स्टेट्स शुड हैव सोलर, लाइक जस्ट टू गेट योर ओपिनियन.
When you look at the solar, that is a more centralized option. Comparatively, India is a sun-rich country. It is not similar everywhere. As I mentioned, you can see the color. If you see the slide, the color indicates the spread of the solar energy. Those red part indicates the highest part. Coming to other renewable sources, yes, the wind is one of the rich sources, but it is limited to certain areas of western Gujarat and in the southern part of Tamil Nadu and Kerala. But again, the wind energy than a rooftop kind of application, where we talk about a decentralized technologies.
Okay. Okay. So for questions, I think somebody has raised their hand. Harshal.
Yes, ma'am. Good evening, Mr. Nikhil. I have a question. If I have a facility where I want to do a hybrid type of solar system installation, like you said, there are two types of system which is connected with the grid, which is off grid. So what the question is, if I just want to have a battery backup for the vaccine storage and the OT, and rest of the health facility, I want it be connected with the grid system. So can we install this hybrid type of system at the health facility? Thank you.
Hello, Harshal. So what you suggesting is two separate system, one off-grid and on-grid on the same roof. It is very much possible. I think that is the point I mentioned. This system is so portable and scalable that you can have both system in the same place. That won't be an issue. But adding to your point, in the current market, recently we have a new technology which is also in the market. We call it as hybrid inverters are also available, which is a step ahead from what you just told. Those inverters can work both in the off-grid mode and on-grid mode. I think a couple of states, I think in southern part, they have already implemented certain hybrid projects on the health facilities also, if I'm correct, in the last 1 year or 2 years, if I remember. So this new technology is there available, but there are certain regulatory and related to the distribution companies, the discoms, to whom you are connecting the grid. There are certain approvals are still pending in certain states, so that is why it is little bit not picking up. But I think over a period of time, it will be in the market suitably available for the both hybrid applications like on-grid and off-grid.
My question is, if our health facility generate extra electricity which will be stored in the grid, if we have a grid system, and can that extra surplus electricity can be sold to the discom to generate revenue for the health facility? Thank you.
So this is actually a commercial thing you mentioned. So selling the electricity. So I will keep this to a general point, not just to a healthcare facility, even at your house also. If you install a solar, you have an option to export the electricity, but they don't see it as a selling part. They always augment it. 1 unit you give me, I will give you back 1 unit. It is just like a banking system. So that is why I initially started my point with a prosumer category. Prosumer are those who produces their own requirements. So whatever you require, you produce it. I can share my grid for banking it for a certain period of time, and I will give it to back. So any month, if you generate more and feed more, next month, probably you can adjust that in your electricity bill. So it will be carry forward every month to your next month whenever you have an excess on the grid set. So it is like a give and take. But this also has a time period over a period of 1 year. They will balance it at the end of March 31st. If there is some excess, then they will pay you for that. Certain there is also certain limit for that. Not like you can generate more and make money out of it, but at a certain price for a certain period of certain amount of kilowatt hour units, they will pay you certain amount. But the ultimate purpose is not the revenue making out of this, but it is to augment your requirement with whatever you generate at the same premises.
My third question, in a country like India, or where maximum electric consumption happens during summertime, or say we have a small health facility called subcenter, where we don't need too much electricity, or say, let's say we need the consumption of electricity shoots in summer. So can we have the solar system on rent type of method in the market? Thank you.
You mean to say you need to rent it like for a certain period of time, like
Yes.
2 months or 3 months? I think that
Yes.
option is not available considering the viability options. But there are business models in such a way that the user need not invest on the solar product, but any third person will invest on the solar project. Say for example, and they will keep it on the roof of your facility or your house, whatever it is, and you need to pay them for every unit you generate. So these are called RESCO models, but not every EPC provides this option. This is certain states, certain localities, certain business people, they provide this flexible business options where the user need not invest in the initial investment. They need to pay only at a whatever they consume, they need to pay for every unit. But on a monthly rental basis, no such options are available because that will not be a viable system from their perspective.
One more last question is, the government gives subsidy for installation of solar system at home. So this subsidy is available on what type of equipments regarding with solar system? Thank you.
The government subsidy is currently available for domestic sector for grid interactive rooftop systems, where you are installing solar modules on the rooftop as a prosumer category for grid interactive systems, on-grid systems, which I mentioned, on-grid system, which I already mentioned in my slide. And there are certain schemes available for solar water pumping, but that is for agriculture purposes.
Okay.
Okay. Thank you for answering the question.
Thank you.
Yeah. One last question about scaling up. So recently I heard from one state that they had installed a solar panel, but now they also realized that they should have battery backup. So what sort of thinking it will allow in terms of like scaling up? Like what sort of resource which you do not have and you might have in the future? That sort of foresight you should have in the scope of scaling up. Like you should have everything that you think of right now, or like in the resource crunch settings, you can think of something later, like how it works.
So as I mentioned in my one of the slides, scaling up is comparatively easy in these technology items. One of the things which need to be taken care is assessing the futuristic load of the facilities. So I think in many places they have a procurement plan. So for 1 year, they know this many loads will be added up. So assessing the futuristic loads would be taken care during the implementation process, number one. Number two, normally the inverter is something which can be a little bit oversized to a certain limit, not to a very high limit, because considering that further loads could be added and further modules could be fielded up if the requirement comes. But most of the inverter technology, if you look at solar inverters, they are capable of off-grid, on-grid, and hybrid options. They comes with enable disable options. So it is preferred that such technology vendors or manufacturers could be identified where they can provide a inverters which can be switched to both on-grid or off-grid mode with a enable disable option, so that in case further if you want to switch over to a off-grid based solution, you can always you don't need to change an inverter. And third, of course, is a space utilization. When there is a mere chance that we are further expanding the systems, then the space on the roof may be accordingly utilized so that we can leave out some space, the inter-row spacings, so that we can accommodate more in the.
Okay, thank you, Dr. Nikhil. We have few minutes left, and I want, if nobody has question, I would like to ask UNICEF team. So, based on your experience, Dr. Mainak and Chahak, what are the simple steps the health facility can take to start, reducing energy consumption or energy conservation?
I think, Dr. Purvi, those steps, Akash sir and Chehak also, they very clearly outlined. Simple things like changing the lights, switching on and off the lights whenever they are required, shifting to star rating equipment, and also this is something which people at facility level can do. But obviously, like Nikhil sir was saying, even at the policy level, suppose in the procurement guidelines or in the GEM, if availability of such equipment were to be there. So this is again high level, not at the level of the health facility. So if those options can be increased, that will also go to a very long way in increasing the options available for our medical officers and colleagues at district level and state level to choose a more efficient equipment. And obviously, like Nikhil sir was saying, one of the steps in energy efficiency is also to go for solarization, the point about decentralized power that he's making. And I think from his presentation, we can see that solar is not something like a all or none. I mean, you don't have to, solarize your entire facility or do not solarize at all. There is a modular option which Dr. Nikhil was mentioning. So, and also one of the questions which had come in from the audience, that was also talking of modular options and combining technologies. So I think these are very good approaches for energy, efficiency. The other point which I also want to mention, madam, and which is also there under the NPCCHH program, is the fact about starting to conduct or set up systems for energy auditing of facilities, which will give you a much more detailed understanding of how to increase the efficiency in your in the facility themselves. But that itself is a massive and a huge subject. But it is very good to see that NPCCHH, the program itself, has a facility for energy auditing, and like Nikhil sir was referring to Bureau of Energy Efficiency. So I'm very sure people can also look towards energy audits as a means of, increasing efficiency in their health facilities. Okay.
I just wanted to add, because I just read somewhere that BEE advises that if we keep temperature of AC up at 24 degree rather than 18 degree, it will save around 4,000 rupees annually. And if we keep it 27, it will save 6,500. So it's not just reducing our demand, but also saving money. So it's simple steps have big impact. If anyone has any question, I'll just check. Otherwise, I think we are at the end of the presentation. We will share the recording and presentations in our group. Do you see any questions, Dr. Mainak or Chehak? I don't see any.
No, we also don't see. And we will share the recording with you, madam, for dissemination.
Okay, thank you, Dr. Mainak, Chahak, and Dr. Nikhil for coming in and giving us this information, and all the participants to come up on the busy day, World Environment Day, and join us on this webinar. So thank you very much, and we will share the information with you. Take care and keep moving. Thank you.
Thank you, ma'am. Thank you.
Thank you, everyone. Thank you.
Thank you. Thank you.
Thank you.
Thank you, ma'am.